Welcome to the first webinar in the 2024 Child Abuse Prevention Month series. My name is Jessica Matley, and I'm a training coordinator with the California Training Institute, but we're best known as Caltrin. We're a grant-funded program through OCAP, and my role here is I'm going to be your host. I'm going to be your moderator, and I'm joined by some of my Caltrin colleagues, Dana Jarzinka and Haley Newton, who will be helping produce this event behind the scenes. And so, as we are getting to know each other over this next hour, you're going to hear great information from panelists, a speaker. We'd love to know just a little bit about you. So if you would please, in the chat, will you tell us a little bit about who you are, where you're joining from? So your name, your organization, bonus points, tell us which county you're in, or maybe you're statewide. Why don't you tell us in the chat? This will also help to ensure that our chat is working today because you might be using it. So you'll just drop your name. Perfect. Welcome. I see Sacramento. Hi, welcome. Great. All the way, I see Sacramento to San Diego. How exciting. Welcome, everybody. And I'm sure that those will continue to roll in. So in today's session, we're joined by a guest speaker and a group of panelists who are going to provide their perspective on supporting families through an anti-poverty framework, which is this particular session is going to be centered around that. We look forward, of course, to engaging with you on this topic and learning from our presenters. So just to give you a little idea of what you can expect today, we're going to open with an incredible presenter who is going to talk about child poverty in California. And then we're going to have a panel discussion. This panel discussion, we've brought in 3 different speakers to ask them some specific questions about their work and how does that relate to our topic today of supporting families through an anti-poverty framework. As we go along, should you have thoughts or questions, you're welcome to drop them into the chat. We do have a full agenda today, so we may not be able to get to the questions, but those will be reviewed at a later date. I want to let you know that we will have a recording that will be made available to you so that you can rewatch this, as well as resources that might be mentioned. All of that will come to your registration email in about 2 days. So if you're excited to get started for this first webinar, I'd love to hear it. At the bottom of your screen, you might see some reactions. Why don't you choose one? You can choose yourself a little heart, maybe, or you could drop it in the chat. Just curious to say, oh, love it. Way to go. I'm excited too. All right. So what I'd like to do is pass the conversation over and I will send it to Hillary Conrad, who's going to give us a little introduction for our presenter today.
Hi, good morning. Thanks, Jessica. Thank you everyone for being here. We're so excited for Child Abuse Prevention Awareness Month. And this is I believe it's the 5th year that we've been hosting this webinar. So we're very grateful that you all have taken your time to be here today. I'm very excited to introduce our speaker. But before I do that, I want to acknowledge the partnership that we have with the Child Abuse Prevention Center. They have been so key in helping us every year in promoting Child Abuse Prevention Month. And they have also been a pivotal partner in helping to make the shift after COVID from hosting Kids Day at the Capitol to now making sure that every year we have this webinar series for all of you. So I'm just going to pass it over to her for her to introduce herself before I introduce Shimica.
Afternoon, everyone. My name is Janae Eustace, and I'm so excited to be here with you. And thank you so much, Hillary, for the amazing partnership. I cannot wait to hear from Shimica and just want to definitely shout you out. I hear we need to meet, and I look forward to meeting you. I want to start by saying that, it's an honor to be in this role, and it's an honor to be here to really just uplift all the lives that are being nurtured and protected and supported, and to really honor those lives that have not been prevented and those young folks who are not here today and those children and youth who need to be protected. It's a large task, and it takes community and it takes partnership. And there's one thing that I know, it's the perfect time to build upon that. And we have all the tools that we need to continue to really uplift child abuse prevention and to really get it to where we are not honoring lives that are lost, but we are just honoring the collaboration, the coalition, and just the partnership to really prevent child abuse and neglect. I'm thankful to be here to represent the Child Abuse Prevention Center. I'm grateful for all of the staff and all of the really special partnerships that have been in place for a very long time. And I'm grateful to carry that forward in the work. And it's truly an honor to just speak in so many different spaces this month and to have an opportunity to hear from our community, to uplift all of those who are doing this great work and who are continuing to prevent child abuse and neglect. So I'm thankful again to be here. I'm honored with all of the family resource centers and the deep commitment from all of those who are doing the work locally. So shout out to you. I hope that you are seen and you are heard and you are honored for the work that you do this month and always. So thank you again, Hillary, for giving me a few moments, and I look forward to hearing from our panelists.
All right, Janae, thank you so much. And thanks again for the great partnership we have with the Child Abuse Prevention Center. I'm very excited because you don't really want to hear from me. You actually want to hear from our lovely opening speaker, Shimica Gaskins, who has been the president and the CEO for GRACE and In Child Poverty California. And GRACE is actually an acronym, but I'm going to leave that to her to explain. She's worked in law and public policy, specializing in legislative, regulatory, and policy issues associated with criminal justice reform and children's rights, which of course are areas that we are all near and dear to our heart. She has a mission to close the racial wealth gap and create economic mobility for California's most vulnerable children. We are very, very happy, Shimica, to have you here today and are grateful. And we know that poverty, there's definitely a connection when it comes to child abuse prevention. So thanks again for being here, and I look forward to hearing from you.
Thank you so much for that wonderful introduction, Hillary and Janae. It really is a pleasure and honor to be here with so many of you on this call for Child Abuse Prevention Month. As you mentioned, I'm with GRACE, which stands for Gather, Respect, Advocate, Change, Engage, and in Child Poverty California. But I really come to this work as someone who grew up in deep child poverty, but had two very hardworking parents and who often had to rely on government programs to have our basic needs met. But, we often would worry if we got that knock on the door, if someone would think, even though my parents loved me very much and they were working very hard, that, they were somehow being neglectful because we didn't have enough at certain times. So for me, this work is deeply personal, and I'm really I feel very blessed to be at GRACE, where together with community partners, we dare to imagine a liberated future free from systemic racism and poverty, in which all children experience a childhood of abundance, dignity, love, and opportunity to thrive. In 2017, we co-sponsored AB 1520 to create a data-driven, comprehensive plan to reduce child and family poverty by 2030 in California. We convened the Lifting Children and Families Out of Poverty Task Force to write that plan, and since publishing the task force report in late 2018, we have been working to ensure the state takes substantive action through its policies and budget to eliminate child and family poverty in California. We are not in this work alone. The In Child Poverty California Coalition is made up of 170 organizations working to connect in concert to achieve that liberated future. And over the last 5 years, our coalition has advocated for more than $15 billion in investments annually for innovative anti-poverty solutions. Together, as you see behind me, we are continuing to fight for a future where all Californians are nourished, respected, healthy, and valued. So I have just a few short slides with some data points to share with you all that we'll start with. And the first is really just we can move to the second slide, to really level set sort of where we are. Unfortunately, California continues to rank as the state with the highest rates of poverty and child poverty in the country. As you can see here, 1 in 3 Californians live in or near poverty, around 5 million people. And we have a child poverty rate of about 13.8% in 2023. Now that is lower than when we started in 2018, 2019, where we actually were a much higher percentage point. But we know we still have about 50,000 children in foster care, about almost 19,000 children arrested every year. And so we continue to face great challenges when it comes to moving people out of the poverty, cycles of poverty. Next slide, please. Black, Brown, Indigenous, AAPI, and immigrant families are disproportionately impacted. These are the same communities that have been divested from, have experienced discrimination, redlining, and economic deprivation. As you can see here, Latino households are experiencing poverty at the highest rates, followed by Black households. These racial disparities are mirrored in the racial breakdown for children experiencing poverty. And research has consistently shown that the impacts on children who experience deep poverty are at increased risk of life-altering conditions, including heart disease, diabetes, depression, arthritis, gastrointestinal disorders, autoimmune disease, multiple types of cancer, dementia, as well as an increased risk of untimely death. So when you look to, who are we really talking about when we talk about poverty? We're mostly talking about communities of color, children of color, who are experiencing the high rates of child and family poverty in California. Next slide, please. So compounding the historic discrimination and economic oppression for certain communities is no surprise that the current cost of living is a key driver of poverty in California. According to the United Ways of California's recent study on the real cost of living in California, for a family of four, is close to $100,000 annually. It was required to pay for housing, food, childcare, and transportation. And what you see here is our PPICs. Although this is still United Ways, the source of what it would take even if you work 3 minimum wage jobs, you would still be making under that real cost measure. And the income gap between the real cost measure and the average household living below is about $41,000. And so but the social safety nets like cash assistance and Cal EITC help reduce this gap. We know that Black and Latino households are disproportionately struggling to meet their basic needs. These racial disparities are exacerbated as the research also shows that single-parent households, foreign-born households, and households with less educational attainment are more likely to live below the real cost measure. Over 4.3 million households in California pay at least 30% of their income on housing. With the continuation of inflation, actually, can we move to the next slide? So you can see this. Yes, with the continuation of inflation over the last 2 years, we all know that these costs have significantly increased and low-income households are feeling the brunt of those impacts. In early 2023, about 3.2 million more Californians, that's about 8.4%, would have been in poverty without social safety net programs. These programs kept 1.3 million children out of poverty, and CalFresh alone kept 1.1 million Californians out of poverty. Next slide, please. Over the last 5 years, the state has made significant investments in our social safety net programs. And during the pandemic, we had the federal government and the state working together to support families economically. And as you probably all remember, the headlines were astounding to some because they said, oh, look, we expanded the child tax credit and we cut child poverty in half within a year, as well as reduced the number of children and families in poverty with increased access to CalFresh and other economic financial supports. More importantly, but many of these effective poverty fighting programs have now been rolled back. And so we know that the poverty rate is much higher than it was at the height of the pandemic because those programs no longer exist. We, at the same time, are subjecting many more children to the devastating and lasting impacts of growing up with poverty. These same programs are the solutions that work and that have the protective factors needed to prevent children from child welfare involvement. Next slide, please. So as advocates, we often are repeating the mantra that poverty is a policy choice, because undoubtedly it's up to policymakers and leaders across the state and country to make different choices about what we will invest in and to ensure that children and families don't live in poverty. Nelson Mandela said that, like slavery and apartheid, poverty is not natural. It's man-made, and it can be overcome and eradicated by the actions of human beings. We can and have made better choices as a state. As I mentioned, when we started this work in 2018 with the Lifting Children and Families Out of Poverty plan, there were 43 recommendations, everything from healthcare to housing to early childhood, social safety net programs, and we made progress with almost 39 of the recommendations having the state having taken some action on them or implementing them for multiple years. But at the same time, we know that we have to continue to do more to not only just meet our goal of 2030, but to ensure that we're lifting children and families out of poverty every single year. And when our legislative leaders prioritize community-driven solutions, progress and changes can be made. I want to really sort of lean in a little bit here in terms of why this is so important when we think about, and at a time of the Child Abuse Prevention Month, the intersections between child poverty and child welfare involvement. From the 2021 study by Chapin Hall at the University of Chicago, we know that the income status of families is a significant predictor of involvement with the child welfare system. And county level poverty rates are associated with foster care placement rates among children of all races, but the majority of California families involved with the child welfare system are experiencing poverty. Fortunately, research shows that improving access to raising levels of CalWORKs and other public benefits mitigates against potential risk factors for intervention by Child Protective Services when negative earning shocks or other toxic stressors occur. Nationally, these protective effects is especially strong for children and families with young children, having shown to demonstrate a 12% decrease in risk for CPS involvement and a 50% decline in the risk of physical abuse investigations. A 10% increase in state public benefits levels, including TANF for a family of 4, has been shown to reduce foster care placements by 8%. And anecdotally, what we have heard from children and families that have experienced the child welfare system is that it's not lost on them that the resources devoted to keeping kids in care often exceeds the amount needed to stabilize a family and move them out of poverty. So we know that cash assistance and a robust safety net is a pathway to prevent child welfare involvement. We also know that more is needed to strengthen the economic mobility and stability of families. In the last few years in California, we've taken steps to ensure that children don't enter the system just based on poverty alone. We've changed the legal definition of neglect. We're working on moving from mandated support reporting to supporting families. We are really pushing forward on prevention efforts. But proposed cuts this year in our CalWORKs program can have a destabilizing impact on communities, and in turn, bring them closer into the orbit of the child welfare system with potentially without the same level of supports and resources and services available. Finally, I think one of the other pieces to really uplift is thinking about our young people who have been in the system and have either aged out of the system and entered into adulthood. The research has also shown that they disproportionately experience poverty and poverty-related outcomes. According to the Child Welfare Indicators Project at UC Berkeley's CalU study on the effects of extended foster care, which followed about 727 TAY youth, it found that 50% experienced at least one economic hardship at ages 19 and 21, and more than a third of youth at 19 and 21 reported not having enough money for clothes or shoes. There's no doubt that poverty can be a driver for child welfare involvement and continues for many young people exiting the system into adulthood, and what we can do better. Next slide, please. Our coalition, the End Child Poverty California Coalition, with others across the state, produces a policy agenda each year that seeks to move policymakers to invest in structural and transformative reforms. This year, we are focused on urging the legislature to make sure that we do not harm our most vulnerable communities. So this is very small. I know you can't see it. Hopefully we will be able to see it in the slide presentation sent to you. But our agenda this year is really focusing on maintaining the robust investments and supports that are critical to the needs of foster youth, ending summer hunger for children and families with maximizing the new federal summer EBT, expanding CalFresh to a statewide minimum of $50 benefit, removing the pause and meet the governor's promise of childcare slots by 2026, 2027 to fulfill unmet diaper needs. I know many of you work with families who need those types of supports, ensure continuous Medi-Cal coverage for children and families, protect the VITA, which is free tax preparation assistance. We've done so much to increase tax credits for low-income families, particularly the young child tax credit, but we need to make sure that families are filing even if they don't owe so they can get access to those resources. And to bolster the place-based anti-poverty strategies that we've seen that work in promised neighborhoods and cradle-to-career networks across the state. And to really begin in earnest to plan for how do we move from the pilots to policy with a permanent statewide guaranteed income. As I said before, we know what the research is now showing us what $1,000, $700, $500 even a month is doing to help move individuals and families forward. And so how can we better utilize that framework with our existing programs and others to support families? In particular, I also want to highlight a proposed set of interrelated reforms to reimagine CalWORKs away from its current sexist, classist notions and fulfill the potential of the program. Here are just a few highlights of ways that we can help stabilize families and prevent child welfare referrals and support family reunification when possible. One is to eliminate or reduce the sanctions to federal minimums, ensuring parents have the income to afford critical necessities like food, rent, utilities, and school supplies. The others is to shift CalWORKs' rigid first focus only to a family's assistance model, enabling counties to quickly offer supports tailored to parents and children, to move from a penalty focus to one in which families create plans to meet their needs, including aligning with the requirements for family maintenance or reunification, expanding work activities to really include a variety of activities that address the family's necessary needs when they're in crisis, and to eliminate the work participation rate pass-through to remove the specter of financial penalty on counties and make sure the family well-being and long-term success are the guiding goals of the program. The steps to reimagine CalWORKs and end deep poverty for all children are powerful, and evidence-based interventions to stabilize families and prevent the traumatic long-term consequences of removal critical to a child's well-being, and will also save in significant social and financial costs associated with child welfare placement. And actually, I'm done with the slides, and we'll just have a few final thoughts here to share. So as I speak with you today, it's not lost on me that the state is actually facing a 38 to or even close to $50 billion deficit. So we're really clear-eyed about the state's current budget condition and what is immediately possible. But we are guided by the whole needs of children and families and the future that we know is attainable when we adopt a values-based agenda, including equitable revenues that is guided by community. Because having an anti-poverty framework isn't just important to the decisions we make with our state budget, but also in the implementation of our programs, and whether it's the social safety net programs or child abuse and prevention programs, which you'll hear a little bit more in the panel after me. For all of us, our highest priorities are to keep children safe and protected from maltreatment and abuse. The consequences of not doing so can be devastatingly tragic. Yet our history has shown us that discrimination and bias have shaped the way we design and implement these critical programs. We have failed many generations of children and families because we missed what they really needed could have been access to nutritional food, mental health services, housing, medical care, economic supports to meet their basic needs, or economic supports to meet their basic needs. Our historical actions continue to shape how communities, especially communities of color, view the child welfare system as not a place for stabilizing help and prevention services, but a punitive arm of the state that will take away your children, harm them while in care, and destroy a family unit beyond repair. Our work now is to continue to peel back these layers of historical inequities, many built within the system and others that we continue to perpetuate. This work, as Janae said, is by no means easy. It requires us to examine our own biases and to truly listen to the voices of our communities, those who continue to bear the effects of economic oppression and exclusion, racism, and marginalization daily. Uplifting community-created and community-driven solutions are critical to effective, sustainable solutions to eliminate poverty and prevent child maltreatment and abuse. Today, we have the power, the knowledge, and the tools to work toward a future where all our children can be valued and free. And with that, I say thank you for having me, and I hope that we can continue the conversation.
On behalf of the attendees, Shimica, I just want to say thank you so much for this presentation. And I hope you can see the reactions on the screen, which is always a great way to show your love, attendees. So thank you for doing that. And I've also dropped the website that was actually at the very last slide, Shimica, with where you can learn more. It'll be right in that chat for you.
Thank you so much.
Our pleasure. And so with that, I'd like to shift over to a panel discussion. And today we've invited several great panelists covering this topic of supporting families through anti-poverty framework. And I want to introduce the three panelists that we have, and then I have some questions for them. So first, I'd like to introduce Damien Ladd, Chief CalWORKs and CDESS, Michael Essien, who's Executive Director of Alameda Office of Education. And I have Pegah, Faed, CEO of Safe and Sound. So I want to say welcome. So thankful that y'all are with us this morning. So I have 5 questions. And as we go along, it's a small discussion here. This is a panel discussion, so feel free to jump in if you have a response. But my first question, I think it'd be great if everyone answered today. Why don't you start by telling us a little bit more about your program?
I'm happy to start. Good morning, everyone. Thank you. I'd like to first add my appreciation to Hillary and Janae and your teams at OCAP and the Child Abuse Prevention Center. We're so fortunate for all your vision and leadership and partnership in transforming how California supports all of its families and children. And Shimica, thank you and your team for your bold vision and relentless work to really end child poverty in our state. It's a hard act to follow. You shared so much important information. So I am Pegah Faed. I'm Chief Executive Officer of Safe and Sound. And for those who don't know, Safe and Sound is a community-based organization that served San Francisco and the Greater Bay Area community for over 50 years. Actually, 2023 marked our 50th anniversary. And the amazing team at Safe and Sound works to prevent and reduce the impact of child abuse, neglect, and trauma. And we all know it has a tremendous impact on children, families, and the community overall. Safe and Sound serves families living in the most vulnerable conditions, including many who live in the city's traditionally lowest income neighborhoods. Just a few data points for you all. Over 90% of the families we serve are low income, according to federal poverty guidelines, and 66% are extremely low income. 61% of these families include children who are 6 years old and under, a critical age range to support parenting and stabilizing families. And the majority of parents are single mothers, with 80% of our clients identifying as people of color, nearly 20% of families experiencing homelessness or non-stable housing. And I'll just close this opening question with that we all know that parents and caregivers for the most part want to do the best for their children. And if these families are experiencing poverty, we heard Shimica really talk about this, how can we expect them to create the most nurturing environment for their children to thrive? And essentially, we know that many families need support, whether that be help getting access to concrete supports like housing and food, employment support, therapy, and parenting classes to ensure they aren't continuing the cycle of generational trauma. And we are here to do all of that at Safe and Sound.
Thank you. Michael or Damien?
I'm sorry. Hi, everybody. Thanks for having me here. My name is Damien Ladd. I'm with the State Department of Social Services, where I'm one of the folks that helps to oversee the CalWORKs program. So CalWORKs is California's version of the federal temporary assistance for needy families program. And the CalWORKs program provides temporary cash assistance for low-income families to help them meet their basic needs. So by families, that means you have to have a child to be eligible for the CalWORKs program. Part of CalWORKs, we also provide, they call it a welfare to work component of the program. So it provides like education, employment, and training opportunities for folks who are receiving CalWORKs with the goal ultimately of helping them to resolve barriers, increase resilience, and kind of move forward on the path towards self-sufficiency.
Wonderful.
Good morning to all. My name is Michael Essien. I'm the Executive Director of Community Schools and Partnerships in Alameda County Office of Ed, and I am part of the STAC, the State Transformational Assistance Center, responsible for rolling out and supporting schools throughout the state of California with the Community Schools Initiative. What is the Community Schools Initiative? The Community Schools Initiative is a robust program that is transforming schools into centers where we provide integrated supports. I'm sorry, it's like I almost going on my throat. I'm not nervous, so we're good about this. I talk all the time. And so providing integrated supports, after school enrichment, empowerment of families, and shared leadership. The legislators of the state of California passed the Community Schools Initiative and allocated $4.1 billion to implement this so that schools can be reimagined as entities that are assets to the community. And so what this means is now, through the Community Schools Initiative, a school can be the place where families can access services based upon their identified needs. And so our responsibility is building the capacity of the various elements of the schooling system at the County Office of Ed, at the district level, which we often refer to as LEA, the leading education agency, that's the same as the district, and what's actually happening at the school. What does it look like to shift how we think about doing school in a way that integrates multiple voices, students, families, which we often say caregivers because the dynamic is a little different, educators, and also organizations that deliver services. So we're in the business now of helping transform the thinking of education as a vehicle to be an asset for the students and the caregivers that are in the communities in which these schools are located.
Wonderful. Thank you so much. And now that we've had a chance to hear, what these different programs look like for these panelists, my second question is a follow-up to that. How does your program fit in an anti-poverty framework and serve as a child abuse prevention effort?
Would you like to start, Damien, or should I?
Either way.
Okay, I can kick us off then again. Well, we heard Shimica talk about the link between anti-poverty programs and policies and how we see an impact on better outcomes for children and families when we are supporting them in this way. And Safe and Sound develops a report known as the Economics of Child Abuse report. And based on that report, we know that there were just over 450,000 reported cases of abuse and neglect in California in 2022, with only 11% of those cases being actually substantiated. And so we looked into that a bit more and realized that the majority of those reports were for general neglect. And the data shows us that general neglect is too often conflated with poverty. The majority of California's children are not suffering from abuse and neglect. They're suffering from the impact of poverty. Last year, Safe and Sound worked with over 11,000 children and caregivers, and we provide direct services to meet basic needs because families can't see their own strengths when they're in crisis. And we do so much more to support families in seeing their strengths and building on them to grow and really maintain well-being for themselves and their families. Specifically, we believe that what makes Safe and Sound really unique is that we work at multiple levels to support and strengthen families and keep children safe. So first, I've mentioned this, we work closely with families to help them understand and build on their own unique strengths, the things that they're proud of, and really what we call their superpowers. And second, we work to build strong community supports and connect families into the community based on their individual strengths and needs, where they can access longer-term resources that they need to create a cycle of change for themselves. And third, and this really is a connection to this conversation around poverty, is that we work locally and at the state level to help shape policies and practices that make families stronger. So for example, Safe and Sound helped navigate the Assembly to pass AB 2085 in January of 2022, which narrows the definition of general neglect and no longer allows reports based solely on the presence of poverty. When we can address basic needs that sets the foundation for growth, then we can really work with families to build on their protective factors. And those protective factors are around social connection, parental resilience, parenting skills, and understanding what children need for healthy development. And by connecting them into ongoing trusted resources right in their community, they have those connections and network to continue to thrive. And the last thing I'll say about this conversation as well is that it's really important to support the staff that are doing this work. So for me, I've been in this role for almost a year now, and a priority for me continues to be really supporting the team around ensuring that we're offering the appropriate wage for the work that they're doing, ensuring that we have the benefits and supports to prevent burnout, to support them, because the work that we do is only as good as the team that can be there to really support families. And Safe and Sound is continuing to explore how we create an organization that's supportive for both families and those who support the families.
Thank you so much. And I believe, Damien, you had something you wanted to add as well.
Oh, yeah, I can kind of build a little on what Shimica and Pegah have been saying. So I actually happen to have some numbers kind of along these same lines, so that they kind of demonstrate the intersection between poverty and child maltreatment. I know that some of this has already been covered, but why not? I'll do it again. So we know that poverty is not really evenly distributed across all racial groups. So I have some numbers based on the 2021 census data that showed that 15.3% of people are living below the poverty line, but that changes across racial groups. So that for non-Hispanic whites, it's 8.8%, Blacks, 27.3%, 8.8% Asian, 11.5% Asian Pacific Islander, 29.6% Native American or Alaskan Native, 22.4% Hispanic of any race, or 15.5% two or more races. So here we see some disproportionality. So when you think about what causes poverty, it's really three primary factors. So you have kind of material hardship, you have parenting challenges, you have sort of adverse environmental exposures. And so those things kind of work together to increase stress and risk for child maltreatment. Just kind of in summary, I realize I kind of went over some numbers there, but we can say that we know that poverty is a risk factor for child maltreatment, and it's unevenly distributed across racial groups. So in that way, policies or programs that address poverty can decrease these disproportionalities and risk factors for child maltreatment. And that's where my program comes in. So CalWORKs does provide material, CalWORKs cash aid. So this is, there's actually a legislative analyst report from 2022, the Legislative Analyst Office. So the LAO, Legislative Analyst Office, they're sort of the research arm of the state legislature. They're a totally neutral third party when the legislature is looking for information about bills or policies or laws. They turn to the LAO so that they provide kind of real straight, hardcore analysis. And from this report of theirs in 2022, kind of clearly state that poverty and economic stressors create conditions in which child maltreatment is more likely to occur. And kind of the converse of that, when state spending on public benefit programs goes up, the rates of child maltreatment go down. So that families living below the poverty line are 3 times more likely to experience child maltreatment. And that's even more so for Black, Indigenous, and families of color. I guess my point here is that you know, income matters when it comes to this issue. And you know, in that respect, some of the things that Shimica was saying, the policies around the CalWORKs program that I help oversee, other programs, you know, not only cash for CalWORKs, but there's housing and in-kind assistance is provided, childcare assistance, the refundable EITC, CalFresh food benefits, of course, medical assistance, Medicaid and CHIP, etc. All of those create kind of an array of services and supports that can all contribute to reducing child maltreatment. And there's a little, I'll kind of finish with a little factoid here that each additional $1,000 that states spend annually on public benefit programs per person living in poverty is associated with a 7.7% reduction in child fatalities due to maltreatment. So I'll kind of leave it there and pass on over to Mike.
Thank you so much. So the theme of this series for 2024, for this month, the theme of really all these sessions that you'll receive weekly is connecting communities. And so I feel this question is really rooted in that theme. How can counties and organizations help families access these services and get them connected? What does that look like? So how do you find out about community schools or get involved? What does that look like to you?
I think this is a great question, Jessica. I think people need to understand what the Community Schools Initiative is, right? What the legislators have basically said is that through the pandemic, they actually got an opportunity, they got a window into the pain and the suffering that was happening across the state of California when we were doing the virtual learning. The virtual learning allowed us to see that. We're talking about increase in suicidal ideations, the fact that we had challenges delivering services to children who were not what we consider neurotypical, that have learning differences. And so what they decided to do was to address the entire system, the entire structure. So there are 3 kinds of grants in the Community Schools Initiative. The first grant is a grant that goes to the county offices of ed. There are 58 counties. 52 of the 58 counties actually have this grant. So that's one, so people need to know that. So if you have a county office of ed, the chances are if you call your county office, they're probably one of the 52. We have planning grantees. They go to districts. And so districts have some planning and some adjusting they need to do. And then the last is the implementation grantees. Specific school sites actually have the grants. So how can people find out about the grantees or who has community schools and what it's? You can literally contact your county office of ed and just inquire. They should have the information around which districts have received the grant within their county, or you can actually contact your district. The district should be able to tell you which schools have received the grants within the district. And if they don't have that information, you can also inquire about, are they planning to apply for any additional grants? How can counties and organizations support this? It depends upon the level. So I'm going to deal with the county grant level. So the county grantees have a specific responsibility. They are to hold conversations with government agencies, community-based organizations, and any other nonprofit organizations or external organizations that provide any types of services to families, regardless of what the services are. The county grant also requires that the county begins to pull people to the table, where whether if you're part of transportation, health, corrections, they are trying to create a system and a structure where all districts within their county can begin to access services in a way that is convenient, in a way that actually makes sense, so that you don't have individual districts trying to create those individual relationships with all of these different agencies. The county organization, the county office of ed is supposed to do those things. Any organization that feels that they are an asset to a district or within a county, they should reach out to the county office of ed, because we're now trying to create, reimagine, and form something new so that we can have a system where people can access this information. And so there's going to be a lot of conversations connected to joint powers of agreement, because we have so many of our agencies, they act in silos. The Community Schools Initiative is trying to decrease the silos and increase people working together. And they've actually done some things to facilitate that. They've passed the CalAIM, which deals with the Medi-Cal billing. They passed the fee schedule. So kids that don't necessarily have Medi-Cal, it's a multi-person payer system where all students within the system can receive services that are connected to behavioral health, and there could be compensation for it. So when you start thinking about what is being presented to us through the Community Schools Initiative, that we really do have to be active and ask questions of our county office of ed, of our districts, and of the school sites. If you happen to be on the school site council, around where are we with the community schools grant? Are we applying for it? Do we have it? And how can I participate?
Okay.
I'm sorry,
go ahead.
I just wanted to just hop in and say thank you, Michael. Everything you shared was just great. And really the Community Schools Initiative has so much potential to really minimize those silos, like you mentioned, and nonprofits and the community resources within the community are going to be really great partners to advance the community schools work in partnership with the county offices of ed. And aside from the Community Schools Initiative, I think there's ways too that families should be reaching out to trusted anchor institutions within their communities, like the nonprofit organizations that really know the community, that often are employing people, hopefully from the community, to really serve the needs of the families, and because they're trusted and in the community, they know of all, like the Community Schools Initiative and other things like that, to really make those trusted, warm handoffs so families can get access to supports.
Absolutely. And, I kind of wanted to follow up a little bit about what you said, Michael, because so much great information. It might be, if that's a first time, if you heard that information for the first time, give us an emoji, because I feel like it's always nice to know, is this new? Is this something? I'm sure many of you were taking notes like I was. I'm curious. Yeah, me too. I'm curious to know if folks want to get involved and they're like, ooh, tell me more. I wonder if I would be someone that could be involved in this, or what could that look like for me? Would you just give us a little bit of information of who do you work with at the county level, or maybe the state level typically? What does that partnership look like?
Great question. So before I lean into answering that question, if people want more additional information, they can actually visit Alameda County Office of Ed website and type in community schools or the STAC, the State Transformational Assistance Center. I will share that link before we depart. And it has information, there are videos, because we also provide webinars. Webinars are open to the general public. Anybody from the public can attend the webinars. We do collective learning spaces. Those are all of the grantees. So there's some learning, and we upload those videos. Now, who do we work with? This reimagining of schools, I'm going to say for the very first time, like many of us have always talked about the government this, the government that, they're getting in the way, they don't allow us to do this. I'm going to say for the first time ever, people are really talking about the state of California because what our legislators have done. This is unprecedented. The California Department of Education is a partner. The State Board of Education, they are partners. The state superintendent for public instruction, they're partners trying to get this to actually work. We have legislators who funded this. They paid the 4.1 billion. They have asked to visit school sites. They want to see the community schools in action because they're also thinking down the road, because we do know that funding is going to end. So then what would the legislators need to do to continue to support this work? Because this work is not going to it's not going to end once the grant ends. There's an expectation that this will continue. So the partners are not only the California Department of Education, the State Board of Education. We partner with all of the individuals that I said, the county coordinators in 52 of the 58 districts. We partner with them. We partner with the districts. We have county superintendents. I have a monthly meeting with the county superintendents because their job is a little different than the actual district superintendents. And we're leaning into conversation, what part of this reimagining of schools is their lot or burden to bear, right? As we try to transform. So we talk to county superintendents, their partners, and then we also talk to superintendents. There are some superintendents who were doing this amazing work prior to the passing of the initiative. When you look at, when you go look at Oakland Unified School District, when you look in West Contra Costa in specific, the city of San Pablo, they've been doing this for quite some time. Anaheim, Union School District. There are people who have been doing this for quite some time. So we partner with them to help superintendents to think through this, because this is a completely different way of thinking about school, where you incorporate multiple voices and you then literally find out the needs of the stakeholders by literally asking the stakeholders. Isn't that such a novel idea, right? So at the core, we find the needs asset assessment. So we partner with all of those individuals. Anybody that I shared, we're building content, methodology, and providing the capacity training for individuals to support people who are trying to think through, well, what could this look like in my context if I just heard about community schools? Or if we've been doing community schools for quite some time, what kinds of support do we need? We are in the business of supporting people regardless of where you are on the continuum of community schools, and regardless of what your role is or position as you think about community schools, as a parent or a caregiver, as a student, as an educator, as an administrator, superintendent. We partner with all of those individuals, and at the core of it, the California Department of Ed, the State Board of Education, and the legislators.
Thank you so much. I feel as though for all the panelists, we are getting a snapshot, a highlight of the work that you've done. And certainly there's been many steps, lots of things that got it to where it is today. This last question we'll take in maybe in our last 5 minutes before we close out. Curious to know if anyone would be willing to answer how you might describe the impact that you've seen of your program in supporting families and economic well-being specifically, and if there's any lessons learned that come to mind for you.
I can jump in and just share that I think in terms of our direct work with families, we think one of our clients said it best, that safe and sound is the closest thing I have to an extended family. That's a direct quote. And that's really, for me, when I talk about impact, I think that feeling for our clients to walk away having means the world, and no randomized control trial could really demonstrate that. Over 80% of our families served through our integrated programming for at least 9 months met their own self-identified goals that were correlated to improving the protective factors that I mentioned around strengthening their families and keeping their children safe. So that's progress and impact for us. And those families who were strong when they came to Safe and Sound, but maybe they didn't know how strong they were, they now have new skills, better connections into the community for things that they need, like housing or educational support or job opportunities, and really a renewed understanding of what they are capable of doing, because they always had it in them. And we've just really worked with those families in partnership. And for us, that's the most important thing in terms of impact, as a significant step towards reducing child abuse and neglect and moving towards economic mobility and sustainability, with families really at the center.
Wonderful. Great. Anyone else? Just wanted to make sure if anyone had any other thoughts to chime in.
I will say, one of the things that we do know about our society is that education has been seen as a vehicle for economic mobility. And at the heart of the Community Schools Initiative is teaching and learning. And what the legislators have actually done is they've said, that there are so many things that occur outside in our community that are connected to poverty, right? Food insecurity, housing insecurity, exposure to violence and abuse, right? That those things enter the classroom. They don't stay outside the walls of the school, and they enter the classroom. And for so long, we have been talking about the issues inside the classroom around kids not performing, being connected to teaching abilities like rigor and learning, Blackboard configuration, and if you've done this, if you've done that. And we know that it's more than that, because children are more than just what occurs inside the classroom. They have this experience. And so what we do know now was this initiative, how it supports people, is it looks at the whole child. When a child walks into your classroom, you're not just getting that child, you're getting that family and whatever experiences that are coming from that community. And now we have a framework to think about, well, how do we support children? Because those services that are provided at the school based upon the student needs are going to allow them to thrive in the classroom. And if they can thrive in the classroom, that will be a bigger factor in them having economic mobility and choices when they graduate from high school. That maybe you can choose to go to college because you have the grades. You were able to have a sense of belonging because other issues were actually addressed so that you could thrive in the classroom, or you might try to be an entrepreneur and be creative and go some other route. And so we believe that this is what we're doing with the Community Schools Initiative. We're addressing the whole child so the child can thrive and have an opportunity for economic mobility.
I appreciate that statement, because I feel as though that you wrap up very well this idea of connecting communities, the theme of this month webinars. And it kind of, to me, it's two different things. It's not just connecting families to needed services, but how do these important topics like anti-poverty framework, how do they connect to each other? And I think that example you gave of how education is a connection to economic mobility was a great way to summarize that. So thank you so much. And if you can believe it, attendees, we are very close to the top of the hour, which means on behalf of all the attendees with us, just want to thank the panelists. Of course, on behalf of the panelists, we want to thank the attendees for being here. We'll be sending out the materials from today's session, which would include Shimica's PowerPoint slides, the note-taking slides that you've received, a copy of the replay, probably some of the resources that were discussed today. That will go to your registration email. Before you go, however, we do have a brief questionnaire that we're going to drop into the chat, and also a reminder that the next session happens same place, same time next week. But this topic about connecting communities is going to focus on equity in action, prioritizing community supports. That information will be available to you in the chat. Actually, they're both there now. Thank you so much. And of course, we want to thank our panelists. So if you want to drop those emojis, that is a great way to do it. And as always, we thank you for your time and your interest in today's topic. We hope to see you in a week. We'll see you this time next week. Thank you all so much. Have a wonderful rest of your day.